The advantages of working within a primary care network, looking at terms of practice management, admin and back office functions, it's about sharing resources, making us more resilient for the future, and ideas such as sharing back office systems such as prescribing hubs, looking at sharing secretarial sources, looking at sharing how we do our clinical letters across 4 practices, and it's about sharing best practice and learning what each of our challenges are in our individual practices. And I think working together gives us better business continuity, which in case helps patient care. I suppose in Darwin, one of the good examples is that we're working with the 4 practice managers. We're actually working with the Department of Work and Pensions. So we're actually working with the disability advisors, working advisors, who actually come into the health centre every Tuesday, hold a clinic, and we can actually refer into those clinics. And actually what we're finding is that patients actually go to see them and maybe not necessarily come to the GP because it's all about benefits and forms. I think the role of the practice manager in the future is already changing. I mean, if I look at it from when I came into practice, which is only 4 years, it's changed immensely. When I started off, I was very much more of an operational manager, looking at day-to-day things. Now my role's changing. I'm becoming more looking at transformational, strategic, what's happening in the wider world. And I think with that, I think you need to be more adaptable to the changes of the system. I think you need to be extremely creative in the problems that you have recruiting medical staff. So you've got to be creative. You've got to look at different clinicians coming in. So looking at paramedics, looking at physician associates, looking at maybe mental health, MSK, and actually looking at working with the wider teams of people like your district nurses, your treatment rooms, looking at working with DWP, local authorities. I suppose the training needs that practice managers working together in primary care networks will need is new. There is a new diploma come out, which is the NAPC, and it's a diploma for primary care advanced management, particularly at scale. So this diploma actually gives you the skills to actually manage businesses at scale, and it actually teaches you how to be more adaptable, how to be resilient. It actually teaches you how to work in networks and how to get on with people. So looking at how people see you and how you see them, and how you actually work together to get the best out of a system, which is difficult. I suppose looking at changes that has been happening with practice manager roles, I think if I look at my role when I came into this practice 4 years ago, very much working in silo, not really looking at what other practice managers are doing. And actually as we start to work together in groups, we're actually starting to share the learning. And this can help in a number of ways. If I look at a particular patient who came into the practice virtually approaching diabetes, by actually referring them into the wider network, so looking at health and well-being, they've managed to actually come right down from being virtually diabetic to not even being pre-diabetic. So it's helped the lifestyle, they've lost weight, they're not as poorly, they don't come to the GPs as much, and generally a very much healthier person. The STP Practice Managers Network in our area is going reasonably well. So in Blackburn with Darwin, we have our network of over 25 practice managers, and in East Lancashire they have around, I think it's around 50 managers. And between the 2 areas of Pennine and Lancashire, we do have a network going. So the local medical committee have actually done some specific training for practice managers around peer reviews, and that's actually bringing us together to actually see what our individual needs are. So we are supporting one another, we're learning from one another, and we're sharing best practice.